What does it look like when your providers see compliance as the partner they can call on anytime? Today, Ross talks with Gary Guidry, CEO of Centerline Health Partners, a post-acute care company based in Houston, Texas. Gary brings over 25 years of healthcare leadership experience, an MBA in healthcare management, and a clinical foundation rooted in cardiac surgery ICU nursing. In this conversation, Ross and Gary explore how critical thinking in a clinical setting translates directly into executive leadership. They also discuss why compliance works best as a collaborative partnership rather than a policing function, and how private equity-backed healthcare companies can grow with integrity by putting patients over profits. Gary also shares how building compliance into every layer of an organization, from the board to the bedside, creates the kind of trust that strengthens partnerships and patient care. This is a conversation worth the listen, as it clearly demonstrates the benefits of when a CEO truly leads with a compliance mindset.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Welcome to the Compliance Advantage. Today we have Gary Guidry, who's the CEO of Centerline Health Partners. Centerline is actually based in Houston, Texas, but Gary resides in the mecca of healthcare, which is Nashville, Tennessee. So Gary, welcome to the show today.
Yeah, Ross, thanks for having me. Looking forward to the conversation today.
Absolutely. You, like me, come from a clinical background as a nurse, and I love talking to nurses who have kind of propelled themselves from the trenches, dealing with patients, saving lives, to executive leadership positions. And then on the second part of that, considering our age, there are not a lot of male nurses in that category from that standpoint. I remember when I was in nursing school, I had a nursing population of about 100 students, and there were 5 men in my class. So it's nice to see. I'd love to hear a little bit more about where you came from to become a CEO of a fast-paced, growing post-acute care business.
Yeah, Ross, it's been quite the journey, I tell you, over the last 35 or so years, and very comparable to your experience in nursing school. We started, I think, with a class of 200, Ross, and as you get through nursing school, that kind of whittles down.
Sure
Right.
does.
And I think we graduated about 60 in our class, and there were three guys. I was one of 3 guys. And
Same.
interestingly enough, the other 2 I still keep in contact with to this day. Yeah, we try to get together when I get back home to Louisiana just to catch up, and we talk about old times, right? The struggles of going through a very high-paced, high-stress nursing school. And then for me coming out, I was kind of continue to be a little bit of an adrenaline junkie, right? So I threw myself right into post-cardiac surgery ICU and, stayed there in that environment for about 10 years. And I always tell this story. My wife and I had started having a family, of course, and I was working straight nights, right? So remember back in the day, you had to work nights to make a little bit more money. So
and weekends, nights and weekends together, right?
Yes. Yeah. I worked every holiday because we didn't have kids early on, right? Every holiday, every weekend, did all of that stuff. Well, 10 years into it, 2 small kids under 3, my wife comes up and says, Gary, I think it's time for you to get a day job. I need a little help. So 10 years in, high stress for being an intensive care nurse as well, an ER nurse, and it takes a lot out of you, right? So I started searching for kind of what I wanted to do next outside of just bedside nursing, and was very, very interested in just the business of healthcare. At the time, I was actually an OR director running an operating room, and my buddies who were the director of ancillary services and the director of the lab, we all decided together to go back to graduate school. So we all went back and got our MBAs. And I tell a lot of folks, RN MBA with a little bit of common sense kind of goes a long way in healthcare. You probably had that same sentiment, right? So I started my admin track and, held every C-suite position in hospitals. And for the past 25 years, I've been in corporate healthcare, primarily private equity-backed corporate healthcare. And it's been really an interesting process for me, just trying to transition, right, as you did, from a clinical setting into a business setting. And I tell folks this a lot as well. I needed to find how do I replace that adrenaline junkie part of my personality right on the business side. So I use the same principles that we learned, Ross, in nursing school that I apply to business, right? We've got the nursing process that we all grew up on within nursing. And I use that same nursing process in business. It works really, really well. So assess, diagnose, evaluate. I mean, go through that process every single day as the CEO now of a healthcare company to kind of evaluate the health and status of where we're going and what we're trying to do within the space.
It's incredible how much our life tracks are very similar, right? I was post-acute cardiac care unit as well. I did some acute care hemodialysis as well in the OR when we had patients that were, had some renal failure but needed a bypass surgery. So, when you talk about using that in your professional executive level position, I do the same thing, assess, triage, assess where you're going to come out and how you're going to deal with the situation, right? But it's also that critical thinking piece that I think is so important, not only as an executive or a compliance executive or any other field that's a leadership position in healthcare. It's really being able to look at a situation and diagnose a problem from it, right?
Yeah, it's very interesting. That's the job, right? Yeah. At least where I sit is problem solving, coming from an operating background like you have, it really, in order for you to be successful as an executive in healthcare, critical thinking skills is primarily top of mind, right? And I think that also bridges into how we think and how I've always thought about compliance. Mm-hmm. I had the opportunity to step into this role a couple of years ago. I wanted this company to have in its DNA a compliance mindset. And remember, when we started in nursing, it was a very punitive client process, right? You didn't have a lot of education. They were the people that said no to everything, right? I remember when I was a clinical nurse and early manager, we rarely wanted to bring something up from a compliance perspective because the answer was no, you can't do it. I think now, particularly as we've been working together, it's become an opportunity to go back to what I referred earlier, which is let's try to solve the problem. Right. But it has to be from a top-down perspective in the DNA of the organization. Russ, I'm lucky enough to have a board of directors that is 100% on board with that. Mm-hmm. It starts from the board to the CEO, and then, of course, down and through the org. And having a compliance program and partner such as you that really lends itself as someone there to help support, educate, and not always say no. Yeah, no is a part of the process. That's why we lean on compliance to answer some of these questions. But my experience has and continues to be trying to foster that DNA, that compliance culture, right? Mm-hmm. As it relates to everything we do, whether it's around compliance and billing, compliance from fraud, waste, and abuse, compliance on the clinical side, all three facets, when I look at our compliance program, really entails all of that. And one of the exciting things for me as we have evolved this company, and you're very aware of it, is that we have brought in professional compliance folks in you and your team. And I see it now every day with my clinicians, my physicians, my nurse practitioners who are now asking questions. And as you know, we want those questions. They're not getting the no. They're getting, well, here's where we can do it in a very compliant manner, whatever the scenario is. So yeah, my philosophy as the CEO really is it has to be in the DNA of your organization, because there's some things, and the majority of things in healthcare, as we know, that are black and white. And there's no gray area as it relates to some things from a compliance perspective. So that's my 2 cents, I guess, as it relates to sitting in the seat as the CEO and a clinician going through numerous compliance programs and making sure that our organization was really set up to be successful with a structure that provided education, training, and information that made us better.
It's such a great insight that you have. And one of the things that I often talk about with clinicians, and this kind of dovetails into what you just said, is, I had a different experience in my clinical path with compliance, which was I didn't see him. I didn't hear from him. I talked to risk management one time in my career, and that was it. And I didn't really know anything about them. Best I was like a charge nurse from a standpoint of an ICU, because then I just went into law school and kind of started going down a different road. So I didn't really get that director or that, VP level in the clinical standpoint, which you did. But, what I often talk about with either, any clinician, whether they're nurses, doctors, NPs, PAs, whatever, is that no one ever told us about compliance when we were in school. They sure as hell don't teach it to medical providers in medical school, and they don't touch about the regulations, fraud, waste, and abuse, False Claims Act violations, anti-kickback, all the things that can destroy a provider's livelihood and anything that they're associated with. They don't talk about it. And maybe they do now, but they sure as hell didn't back then. And a lot of people that are practicing are our age, right? And so you have this great kind of concept about compliance not being a hurdle or being the CF no, as we always say it, right? Was there a moment in time or a mentor or somebody out there? Because I know a lot of CEOs, Gary, and I deal with them a lot, not our clients, because all of our clients are A plus, right? But I know a lot of them out there who don't understand compliance. They don't understand why it's an investment. They don't understand what the benefits of it can be. They're just like, oh shit, someone tells me I have to have it, and therefore I'm going to put it in place, and then I'm going to get rid of it as soon as I can, right? I'm going to cut expenses. I'm going to cut compliance first because that's the easiest. So was there a mentor? Was there a spot in time? Was there somebody who was like, hey, this is why it's important, or was it an experience or something?
Yeah. So I'll give you 2 great examples, Ross. One was an experience, one was a mentor.
Okay.
So right after I got my MBA, I joined an organization as a chief nursing officer, right? And this was, early 2000s, when you started really seeing a little bit more of a focus, right, on some of the regulatory fraud, waste, and abuse aspects within healthcare, right? And as a chief nursing officer, I sat on obviously all of the committees at the hospital, right? One of which was the quote unquote very early stage of a compliance committee. Well, one of the first things that came up in the very first meeting, Ross, that we convened was a letter from the OIG about one of our employed physicians that had some quote unquote billing irregularities, right? So I got exposed as an executive in a hospital going through an entire OIG. I'll call it a colonoscopy, Ross, because that's essentially what it really felt like in terms of just the level of diligence the regulatory government, i.e. government, right, went through to pin, and this physician really got sanctioned, fined, had his license removed for a year, and then came back in. So personally, that of course got compliance early in my executive career on my radar.
Yep.
The second piece is what brought me to Nashville was a company called Specialty Care. And the CEO of that company was a very well-known Nashville executive named Gary Guidry. Very well-known. Gary's passed on now, but one of the first or second meetings I had with Gary, and I joined them as a senior vice president over one of their divisions, was let me introduce you to our compliance department, Gary, because you're going to want to be involved and intricate in understanding what they're doing. And of course, I'd given him the example of my experience, and he was like, wonderful, but I need you now to interact here because you're going to sit on this committee for us to be deeply involved. And he was the type of executive that every time we would meet, there was a compliance point on the agenda to discuss. So he instilled in me early on the importance, right, of making sure that you had a very well structured, very well documented, but more so very much collaborative, a relationship between your operating components of your business and the compliance department.
It's such a refreshing, and early 2000s or even all the way through the 2000s. And that's same thing with me. That's exactly when I started getting into compliance, right? It was, early 2000s after graduating from law school. And it was kind of the same thing. Yeah. One of my first jobs I got as a compliance officer, and I tell this story all the time, so listeners are probably tired of hearing about it. But, I get there, a friend of mine calls me up, says, hey, by the way, why don't you be a compliance officer for our health system here in Dallas, right? And I said, sure. What's a compliance officer? I don't know what the hell that is. I'm looking it up. Got there 3 days, just coming out of the, law department, and as well as like a clinical setting where I wore my pajamas every day to take care of patients. Right now I have a suit and tie on. Yeah. I go into my office and I see this blinking light, which I've never seen a blinking light. I don't know if home before, because no one ever was on hold or left me messages in the ICU. And I just couldn't figure out how to get it off the phone. Right. I couldn't understand it. And about 2 days later, I walked up, IT guy. I'm like, what's my password? Like, how do I get this stupid phone thing off? And they're like, okay, here it is. And I'm like, okay, I got it. And so I'm like, hey, like, what is this message? It's like the OIG calling and telling me that they're actually going to be there next week for a site visit. So get ready. And I'm like, first like week into this. So I completely understand the issues.
It's funny. It's very parallel. It's feast or famine, right? You're kind of like, okay, what is this? Again, early 2000s, what is this compliance thing, right? Well, what is it? What do we have to do? What are the components of it? And as I went through that process, Ross, my thought process starts changing. Back then, there wasn't a partnership, as I said early on, right? It was very much antagonistic between each. And I took the approach that it's got to be collaborative. It's got to be a point that is made between both compliance and operations. So there's an understanding on how to, again, back to what we just solve this problem. We're in the business of solving problems, right? At the end of the day, that's what we're doing, trying to mitigate that risk as best we can through the structure we place within the programs. And it took me, and I don't know about you, but it took me a couple of years to kind of get my head around that, quite frankly, because it was such a new concept back then. And then fast forward, Ross, to where we're at present day, 2026, with all of the regulations that are out there, all of the components that our clinicians, our bedside clinicians have to really remember. There's no way. My point is, as a CEO of a physician practice, my role and my goal for our providers is to remove all of the administrative components that we can legally, ethically, et cetera, so that they can do what they do best, which is take care of patients, right? So having a really high functioning compliance department to deal and help guide clinicians through this regulatory environment we're currently in is crucial. And particularly, as you know, in the space that I operate in the post-acute space, oh my goodness, you talk about the wild, wild west in terms of some of the things that are out there. Back to the parallels with your career and my career, both come from physician practice management backgrounds on the acute side of healthcare, where, quite frankly, if you compare it to the post-acute space, everything in the acute side is kind of buttoned up, right? You've got processes, you've got technology, you've got compliance, you've got everything that you need to really run an acute care physician practice. Transition to where we're at in the post-acute space, which I tell folks, coming from the hospital medicine side of where I was involved with, we're 20, 25 years behind as it relates to the post-acute space, quickly getting up to speed. But as you know, and I know, historically, the space has been fraught with fraud, waste, and abuse, right? So part of forming Centerline really was partnering with a couple of physician practices, one in Houston, one in Dallas, Houston Truman Physicians and Associates, Dallas Meridian Health Partners. And as I was going through my process of joining, we had already acquired the Truman Group, but my immediate introduction was speaking to the physician leaders who had a compliance mindset, who wanted to really make sure that things were done the right way, both compliantly and also ethically. Same thing when we went through the process of acquiring our Meridian practice. I was deeply involved in the diligence piece of that, and it was very comparable. The physician leaders there had a very compliant mindset. Now, granted, they didn't have the structure right in place. That's where I asked you to help us, and thank you for doing that. But I started with a basis of 4 physician founders that had a compliance mindset within their practices that was, again, back to in the DNA of those practices. And it just makes it a little easier and open when, again, we have those leaders at the physician level, right, speaking to the physicians in the practices about compliance. Matter of fact, we hold monthly provider meetings with both of our practices, and an agenda item on every single one, if you've seen some of the slides, is compliance, right? Any compliance issues. Here's our compliance officer. Here's the email. Here's the hotline. And that's reinforced in the org every single month.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
In your space on the acute care side of it, people are sick and they come to the hospital, right? They're emergency department, they're in ICU, something's wrong with them and they have to be there. On the post-acute side of it, you're like, should you be seen? Should not be seen? There's a lot of judgment there that needs to happen. And in your space, and you talked a lot about kind of what they're doing right with providers who are involved and engaged, especially when you deal with the founders and the leaders of specific, PCs that you're helping operate as an MSO. What do you see that them doing wrong? Is there something that you're seeing that could be kind of a little bit of on the edge that you're like, hey, we just need to tighten that up?
It goes back to what you and I talked about, quite frankly, which is on the billing coding side, right? We needed some oversight there. We needed some audits. We needed some education. We needed a program. Not that I thought something was going wrong. The problem was I didn't know. Right. I didn't know. And when you don't know, then those issues pop up. Luckily, we've gone through a couple of rounds now that I'm comfortable on where we're at as it relates to some of the outliers we saw through that process. But yeah, on the clinical side, also, this space, unlike the acute side, where on the acute side, patients are being seen every day by a provider, right? In our space, really, doctors not seeing them every day. Nurse practitioners not seeing every day. So I had some concerns early on with both practices about frequency of visits, right? Making sure that we stood within the Medicare guidelines of visit frequency. And luckily, we've audited that process. We've gone through that. But that was another question in my mind that I just didn't know, right? Because again, we've acquired practices that just didn't have that formal process in place.
We talk a lot about the compliance advantage here, right? Because it's the name of the podcast. But I think that's a huge piece that you just brought up, which is knowing, right?
Yeah.
I mean, the False Claims Act says causing a claim to be submitted knowingly or unknowingly to the federal government for reimbursement, right? An inappropriate claim and getting money for it. So the unknowingly part of it is a real big advantage by saying, hey, now I know. Now I know what I
Yep.
know, and now I can fix it. And I think
Mm-hmm.
that's a huge advantage that people don't understand from a compliance program standpoint, because sometimes the government's not looking for an I gotcha moment. They're looking for,
Right.
do you have a process to detect, prevent, and
Mm-hmm.
mitigate things from happening? And you can't do that until you know. So really understanding that from your perspective, I think has put Centerline and yourself in this advantage category to say, I absolutely know what's going on in my business. And I know we got some warts and
Yeah.
we fixed it, and that's fine. But I think
Mm-hmm.
that is a huge advantage that a lot of companies just don't get and don't understand.
Yeah, I totally agree with you. As I've talked to kind of colleagues out there who are maybe in a scenario where they're just stepping up into a CEO role, or maybe they're mid executive level, I've always impressed upon those guys, what are you doing from a compliance perspective, particularly in our space or other spaces, right? Make sure you have that engines, for lack of a better term, and that muscle memory within your company so that you can mitigate those things. Because, I mean, this is healthcare. Things happen,
Yep.
stuff happens, and it's going to happen. I tell my team every time, expect the unexpected because it's going to happen. Where we come into play, and our job to support our practices is, how do we respond to that? Right? How do we solve that problem? Do we have a firm process? Do we have a reporting methodology that works and is understandable, that we now know what's happening? And
Mm-hmm.
again, when I first joined the org, we just were so early and young,
Right.
we didn't, right? Now we do. And again, I'll go back and credit my board of directors for really, again, speaking from having a compliance mindset. And you sit on our compliance committee at the board, you deal with our committee chair, Woody Grossman, who
Mhm.
that is all they're focused on in that committee, right? We go through talking about compliance from a high level. We set up the process in our company where we're meeting weekly as a compliance committee. We're meeting routinely as an executive compliance committee, so that we now know what's happening within the org. And we've run across some issues that we've had to handle. And that's the beauty about having that feedback mechanism within our organization. So I'm very well pleased with where we're at. Now, can we always get better? I know, of course we can. But having that thought process always come across my mind, and what comes across my desk from a compliance perspective is, do we have the team in place? Do we have the resources in place? Do we have the communication pathways in place to really tackle these issues that pop up and will pop up?
There's such a there's such a dichotomy going on nowadays, and I think you answered the question already that I was going to ask. But you're private equity backed, and we deal with a lot of private equity firms, and the government has kind of put a little bit of a target on private equity and
Yep.
healthcare on their backs to say you're making money off of patients, and that's not at all what all of the private equity groups that you and I deal with are about. They're about improving network capabilities and patient
Yep.
networks and being able to provide good quality access care to a lot of people. But there's obviously some friction there with private
Mhm.
equity wanting to do growth, right? That's their job, right? They got to grow the business and
Sure.
they're going to churn it. And then the regulators kind of putting their thumb on it a little bit. But I'm assuming that when you get that tension in place, that your board is really the one that is the mediator between those two, because you got some independence, right? And you got some management,
Yep.
then you also have your board that's comprised of your private equity partners. So is that how you're dealing with that on a daily
Yeah.
basis?
Yeah, Ross, that's exactly how we're dealing with it. And I feel very lucky to have the private equity sponsors that we have in Petra and Capital Alignment, who uniformly have told me, both formally and informally, let's put patients over profits,
Mhm.
right? Because they have the mindset that I have coming into it, which is, a mentor told me long ago, Gary, if you take care of the patient, the clinical, financial, and operational components take care of themselves. Do it in a very ethical, legal, and compliant manner, you're going to be successful in business. Our board takes that approach as well. I've never been approached by my board to say, let's go after this XYZ process because it's going to provide us the growth we're looking for.
Right.
It's always, what does it mean from a patient care perspective? And I think that's important for folks such as myself or anyone out in the space that is looking to get involved with private equity-backed healthcare companies. Yes, there are some that weren't very good, but you want to make sure that they are. And the way you do that is, patients over profits. Do they have that mindset? And again, I've been very lucky in my healthcare career. I've been with 5 private equity companies, all of which fell within that range. So I haven't been exposed to the dark side of private equity. It's always been, let's make sure we take care of people because we're in healthcare. That's what we do. If we do that, then we know the profit component will take care of itself.
Yeah, part of that, I think, is the government just seeing how private equity is getting involved so much in healthcare, and they got to say it right.
And Russ, I'll interrupt you for a minute. I have a little different take, quite frankly. It is this. The post-acute in healthcare has been an afterthought.
Sure.
Right? There hasn't been a lot of capital coming into the space. There hasn't been a lot of emphasis coming into the space. Hence, maybe that's the reason historically you've had some fraud, waste, and abuse in the space. Not a lot of emphasis. Well, as we know, there are a number of drivers right now in the U.S. that's driving post-acute care, right? Aging population, baby boomers, all of those statistics daily growing with folks that are over the age of 65. And because of that, there's now more emphasis and interest in the post-acute space. So where I'm going at here is with private equity getting involved, you're now having more capital come into the space to be able to fund and take care of patients down the line, right? So regardless of what post-acute component you're involved in, whether it's physician practice management, hospice, home health, skilled buildings, whatever, I think it's a good thing that you're having more interest, eyes, both from the government's perspective and also from private entities, right?
Yeah, and the more capital that goes into the system, the more companies like yours, Centerline et al., have the ability to create that infrastructure of compliance and quality and risk management and all the things that can make or break a company. And you talked a little bit about, patients over profits. You talked a lot about that, and that being a core metric for you guys, which absolutely should be. One of our kind of themes for the compliance advantage is patient trust equity, right? And what that means, if you have a good compliance program who's not defrauding the federal government, not charging you for things they shouldn't be charging you, not doing things they shouldn't be doing, not making up records, not treating you badly or providing bad, poor quality care, it builds trust with the community and patients, and they go, that's where I want to be. Those are the docs that I want to see. And I know your business and your business model is all about relationships, and it's about relationships with good systems that go, these are our number one people that I want to deal with. Patients are trusting their health systems are trusting you. And therefore, by that dynamic, that trust then exists. And I think a lot of that has to do with, you're a good egg. You're a good actor. You've seen the advantage that we could do. You're like putting patients over profit, and you're also creating that trust equity.
Yeah, you trust is big in this space, and it's one of our core values as a company. And you hit the nail on the head as it relates to relationships within the space we're involved in. And yes, we want to deliver the best quality care, demonstrate that quality care that develops the trust with hospital systems and buildings where we take care of patients and residents, of course. So one of the things, again, back to the core tenets of what we discuss with our clinicians is those relationships, those trust pieces. And while the competency of the clinician is very important as it relates to taking care of your family member and that patient in the post-acute setting, the relationship and service that you deliver is equally important, right? We've got some things we call our clinical service standards, right? And I'll give you just one that's very simple. That is, on the first visit that we see a new admission or a new patient, we're obviously speaking to the patient immediately, but we're also calling the patient's family or their significant others. Because one thing in the geriatric patient population that's very important is the family dynamic and making sure we are meeting those needs, right, when we go into those. And we've got tenets around clinical service standards that are just, this is the way we do things. And the
Right.
relationships and the service component are just as important as the quality of care that we deliver.
I mean, there's that old adage, and I've seen it because I was in risk management before I got into compliance, is same quality care, and maybe it's mediocre and maybe it's good or whatever, but who's getting sued? It's the
Yeah.
asshole physician who's getting sued, right? And it's the one who's nice as can be because they have a good relationship with the patient, and maybe it's good care, maybe it's marginal care. They're the ones that, because it's all about satisfaction, right? The patient feels like
Right.
they can trust you from that perspective. Now we should always
Yes.
be giving good quality
Yeah.
care. So
Yeah. And again, equally, I go back to that in the geriatric patient population, the family dynamic is equally important. So not only are we developing our relationships, obviously, with the patient that's sitting there in the bed, but also the family and around them. And also, of course, making sure that in the buildings where we're rounding and seeing patients, that we have communication across the care continuum, the TAR staff, right? So yeah, there are a number of different things in this space, as we've talked about, to the back to our acute care experience, that is just totally different as it relates. But I tell folks when we go in to, look at a building that wants our clinicians in, and I tell our clinicians this too. I feel, and I'm very biased about my organization, that because of the processes we have in place from a compliance, regulatory, model, clinical, et cetera, patients in the markets where we go deserve to be taken care of by our clinicians. They do, because I feel our clinicians, physicians, nurse practitioners, physicians assistants, are the most well prepared to take care of this geriatric patient population than anybody out there in the country. And again, Ross, obviously being very biased as the CEO of this organization, but I demonstrate that by the metrics that I see each and every day compared to others, which ours are outstanding compared to everyone else.
well, if you didn't believe in your company, you probably shouldn't be the CEO of it. As you're talking, you're advising, you're mentoring CEOs, board members, investors all the time. And I know you're talking to them quite frequently. What's your best advice when it comes to compliance, or looking at compliance as an advantage to say, this is how I think, this is how you should think, and this is what I see as the best?
I think it goes back to what we discussed, and there's only one way things should be done, and that's the right way. And when I advise and I speak to my board and I speak to my team, I go back to just the very simple, there's black and white, guys, and we've got to stay within the black and white. There's no gray as it relates. And if we think we're even inching into the gray area, your first call needs to be to our compliance department, because they're our experts, they're our resources, they're our collaborators when making sure that we are doing things the right way. And there's no negotiation from my seat as it relates to that.
And I also feel like I'm a big gut feel kind of person, right? And I've always said from first part of my career, if it doesn't feel right, it ain't right. There's something off there. So just call somebody. I mean, I still, in this day and age, need to bounce things. And I've been doing this for 20 years, bounce things off of somebody else to go, something's just not right with me. And I don't know what it is. Help me understand this. And it's just a perspective issue. So I love that kind of guidance to say, if it ain't right, it doesn't smell right, doesn't look right, don't eat it. Right.
Yes. Yeah. Good point.
So last thing is, we consider health as wealth. The people that I deal with every day are in healthcare. And I always say, if you're in healthcare, you should be taking care of yourself. And as well as I do, nurses are probably the worst at that from that perspective. Yeah. But what do you do to take care of yourself so that you stay kind of ready for your job as a CEO and to tackle the world?
My silence, Ross, is probably much like you. I'm a gym rat. I love the gym. I've been in the gym now for 30 years. And these last 30 years, I haven't changed my routine. I'm up at 5 o'clock. I'm in the gym at 5:30. I work out for about an hour, usually 4 days a week. Try to when I travel, because I'm quite a bit on the road. So I know the intricacies of each hotel gym now, probably by heart. But I've always done that. And probably like you, if I don't start my day that way, it really messes with my psyche. And it started probably from my clinical days, because, when you work 7A to 7P, you're up at 5 o'clock before trying to get to work. So I just kept that same routine when I jumped onto the management side. Just kept waking up early. When the kids were smaller, it was my time, right? And now that the kids are out and both married, it's now still my time. But it's been interesting. One of the things I've really been diving deep into is kind of some of the recovery components. So I just recently bought a home sauna, which
nice.
If you don't have one, it's fantastic. I haven't bought into the cold plunge stuff yet, but I probably will. I don't know. But I love the sauna. Now, when I get back from working out in the morning, I'll spend 20 minutes in my sauna and then go out, just feel refreshed. And then looking at longevity, right?
Yeah.
It's been really eye-opening for me to be in the geriatric space now, right? Yeah. I mean, my point is, I want to live as long as I can, but as healthy as I can for the long term. So a lot of longevity strategies, right? Rest, sleep, monitoring. I do supplementation, right? Making sure that I'm, up to speed on all the various nutrients that I need to take in. Pretty diligent, eat clean as best I can with, moving around. So yeah, I'm certainly focused on my health. Have been, quite frankly, just more so now that I'm a little older, Ross.
You hit one of the pieces that I am a very big fan of, and I heard this from, I can't remember who I heard it from, but I would give them credit if I could remember. Big difference between lifespan and health span.
Yes.
And when you say my lifespan is X, Y, and Z, well, it's not really important if your health span is not equative to that, right? And so, I would rather have a shorter health span than a longer lifespan, where the last part of my life, and as you said, in the post-acute care world, you can see what happens. And you can see in like ALFs and skilled nursing facilities that people who may not have a great lifespan or health span, and I agree with you 100%, like increasing that health span is really where we need to be. And if I'm going to live till 85, I need to be a healthy 85. I don't need to be a kind of an 85-year-old.
Same here. I want to be lifting weights at 85 in the gym and feeling good and doing all the things I want to do and doing it in a healthy scenario. So yeah, I try to read as much as I can these days on longevity and not looking at all the trendy things that are happening, just look at some of the science-based things right around that. And I'm lucky enough to have a primary care physician that's very collaborative and working with me on that. So yeah, I would advise, make sure your primary care physician is aligned with your goals from a health perspective, particularly around lifespan and health span, like we're talking.
Well, I'm really glad you're not buying into this whole hair thing, because I think bald is beautiful, and God made a few perfect heads and the rest he put hair on. So
you're right. I would totally agree with you there, Ross. Totally.
Well, Gary, thank you so much for joining us today. I love this conversation. You and I talk quite a bit, so I'm so glad you came on the podcast today. And take care of yourself. I know you will, and I really appreciate your time today.
Yeah, thanks, Ross. Appreciate you having me. It's been fun.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.